All right, so hello, my name is Samir Maroof, and for this year's PURM project, I did the analysis of anesthetic depth with process EEG and nurse under the mentorship of Dr. Ian Yuan. And so basically, to give a general background, neurocognitive abnormalities and neurologic injuries have been observed within patients undergoing general anesthesia, especially during cardiovascular and neonatal surgeries. And so basically, in our research, we look at the nurse and EEG data of these infants throughout their surgeries to help us determine the likelihood of a neurologic complication occurring. And for those who don't know, NIRS stands for near infrared spectroscopy, which is basically a brain imaging method that measures the oxygen saturation within the cerebral tissue of the patient throughout the surgery. And EEG stands for electroencephalography, which is like a method of determining the brain activity within the patient throughout their surgery. And it mainly consists of four channels that may flatline, which informs the surgeon that a complication could occur in the future or is occurring. And so basically, for this project, my responsibility was to use MATLAB, which is a coding software, to process the data of nurse and EEG uh, for each patient. And so basically, prior to doing so, an oxygen saturation baseline was calculated for each patient first by averaging the first oxygen saturation values of each patient. After doing so, the baseline is then used to determine when the oxygen saturation is considered mild, moderate, or severe, which basically means how below the determined baseline the patient's oxygen saturation may be during their surgery. And so that is specifically for the nurse data. And then for the EEG data, we mainly looked at the time intervals of when the EEG flatlined for greater than 10 seconds. And that was recorded and tracked. And going back to the nurse data, whenever the patient's oxygen saturation dipped below a certain threshold, whether it be mild, moderate, or severe, for greater than 3 minutes, it was recorded and further processed. And so, as you can see below in the data collection section, these are a few examples of the patients and their oxygen saturations throughout the surgery at different timestamps, which are also defined in the methodology section of this poster. And so certain patients, as you can see, such as patient 4, does experience a dip below the mild and moderate threshold for greater than 3 minutes, which is recorded and further processed for the research. And so yeah, moving forward, the data of all the patients are looked at holistically, and we basically look at the frequency of these dips occurring as well as the flatlining during EEG. And hopefully, moving forward with our research, it can help us determine of the likelihood of a neurologic injury occurring within future patients. And yeah, that's the general scope of my research throughout the summer. And hopefully, I will be continuing to do research throughout the semester.